Well, I'm a big believer in the mind whole body connection as far as, meditating, praying.
Yes.
Exercising is part of my routine every day. And eating well.
That's wonderful.
I think you have to connect, the mind, the body, and the spiritual all have to be working together in order to achieve wellness.
I love that. And that's why you are such a good leader. Hi, I'm Haylie Pomroy, and I'm the Assistant Director of the Integrative Medicine Program at the Institute for Neuro-Immune Medicine. Thank you so much for joining us on our podcast today, Hope and Help for those dealing with fatigue and chronic illness. Today, I have an incredible guest coming to the table, Dr. Jackie Junco. Dr. Junco is a practitioner at the Institute for Neuro-Immune Medicine. She's the assistant professor at the Dr. Kiran C. Patel College of Osteopathic Medicine. Dr. Junco also has her master's in Oriental medicine. Dr. Junco, thank you so much for being here with us today.
Thank you so much, Haylie. I'm glad to be here.
It's very exciting. There's so many topics right now about integrative medicine, what used to be called alternative medicine, but really about looking at the patient where they're at and looking at the complexity of their disease processes and bringing solutions to the table. And so I'm very excited to get to interview you because you have a lot of solutions that you bring into our clinic that really seem to make a difference in a person's trajectory. So Dr. Junco, how did you come to the Institute of Neuro-Immune Medicine?
Wow, that's a long story. I'll wrap it up pretty quickly. I started with Dr. Klimas back 20-something years ago, my fellowship in immunology. And while I was there working for her, we established, not only a relationship as colleagues, but we'd established a friendship. When she came to Nova, she wanted me to come on board. So I've been here for 2 years now.
Wow.
And it's been a wonderful experience.
So you started in immunology.
Correct.
And can I ask you, what was the precipice? What was the passion? What was the motivation to bring on acupuncture and all of the additional modalities that you incorporate?
When I was doing my fellowship at the University of Miami, I took an acupuncture course for physicians like 27 years ago, actually. And when I took that course, I found that what it did was amazing. So I enrolled in the Master's in Public Health program at and I focused on preventive medicine. And I also did a certification course in integrative nutrition. And then many years later is when I did my master's in Oriental medicine. And that's what I sort of started seeing, the change in the need for integrating different modalities versus whether it's Oriental medicine, nutrition. And for me, a lot of it is prevention. If you prevent the illness or the disease, you don't have to treat anything.
Oh my gosh, that's a very good perspective. In our practice, we get a lot of individuals that are coming in that have really complex diagnosis. What are you seeing in the clinic? What's kind of the typical patient that's coming in to see you?
Well, I see a lot of patients with a lot of cognitive abnormalities, a lot of fatigue. Pain is something that I treat a lot. And I think the fatigue is one of the most common ones that I work with directly.
So when you're looking at an individual, let's say chronic fatigue syndrome, ME, CFS, a lot of people that are out there listening right now, maybe they haven't had adequate diagnosis, adequate care. One of the first things that we say is that we believe you, right? We know that your symptoms are real, your experience is real. And when a person comes in to the clinic, what are the areas that you like to focus on first? Are there things that you feel like if you don't address those, it's really hard to get them on a health journey?
Well, I think, first thing, these patients come to us in so much need because they haven't gotten any answers anywhere else. So they come to us, hoping that we will help them. And I believe, going into the most important things for me are stress,
okay,
sleep, and pain.
Right.
So I usually address those in the beginning and then, develop a treatment plan or strategy from there.
So you talked a little bit about, we're a center for hope. We're a place where we're usually not the first stop, unfortunately. What do you think sets INIM apart from other clinics that you've had experience or exposure with?
Well, I think we have amazing team of clinicians. And I think the whole idea of integrating is the integration that we have within ourselves. We have different practitioners that are a little better at this, a little better at that. So I think it's treating the way we treat the patient, we see the patient as a whole. And in my case, I like to see it like, we're peeling the layers of the onion,
Right.
peeling the onion. So I feel like, you have to get to the root of the cause.
Right.
And by the way we see the patient at our center, that's what we hope to achieve.
Right. And I see that, like, we have talked a lot in our podcast about these Friday morning meetings. Can you tell me or tell our viewers really a little bit about what those are and the value of those and what happens there?
At our meetings?
Yeah.
Well, we usually just have all our clinicians and we present all these complex cases, which we have, and everybody gives their input and their ideas and what the strategies could be to help that patient.
When I first came to the Institute, I think that was so impressive to me. And we were talking one day about how many hundreds of years of clinical hours or clinical experience go into kind of viewing those patients in that Friday meeting. And I think a lot of it is, to your point, there's a lot of different specialties, there's a lot of different perspectives. But I think that we see, and I want to jump into this for a second, the power of all the modalities that you bring to the table in our clinic. Can you share maybe a handful? I know you do a lot for our patients, but a handful of some of the modalities that our patients have the honor of being exposed to.
Okay. I think the majority of my patients I treat with acupuncture or Oriental medicine. The herbal component of that is fascinating to me because you could do so much with Chinese herbs. Unfortunately, these patients are taking so many medications that I really hesitate to do that unless, their other practitioners are on board also because, you might get into interactions with different medications. So herbals are sometimes not the best solution. But I also integrate nutrition, the stress management, being in that, being more mindful, doing meditation. I also recommend Qigong exercises, breathing exercises, all these things that help, bring us out of that sympathetic fight or flight and shift their autonomic nervous system to a healing process. I
think I'm going to ask you about a couple of those modalities, but I think one of the things that is fascinating to me is that you came at this from looking at the immune system. And there's medications that are involved in treating immune modulation. And then you come in and you say, wait a minute, let's look at the body first. The body is a body having an immune stress response or an inflammatory response. And so addressing that whole body and bringing it back into homeostasis corrects a lot of the things that are going on in the immune system.
Absolutely.
Yeah. And so you just mentioned a couple modalities. Tell us what Qigong is.
Well, Qigong is similar to Tai Chi because that one's the one patients are most similar to. It's just like simple. And I recommend it for this patient population because they could even do it while they're sitting because they always say, I can't exercise because I'm too tired. Well, doing the Qigong, it's movements of your arms, of your legs, of your hips, of your head. And it's just using your body to move that energy. We say energy in Chinese medicine, but in Western medicine, we say you just get the blood circulating. You want to get that blood flow, which is very important.
Yes. And when we talk about moving the energy, or in Western medicine, moving the blood, why is that important when a patient's dealing with inflammation or fatigue? Why is that important?
Because when you don't move, you stay stagnant. So the blood's going to, you cause pain.
Yes.
It's going to cause, cytokines to be stimulated. It's going to cause your stress response to go higher. So we need, moving is key. I think, a person who moves and gets their body, even if it's a minor exercise, even if 10, 15 minutes a day, it's going to help.
Can you explain to some of us, I grew up exposed to acupuncture. As we've shared, my mom is an acupuncturist. And so, my kids, myself, those that are out there that maybe haven't experienced acupuncture, I'm going to ask you some of the common questions that our community asks us. Is it painful?
It can be. Because when patients
tell me no. No, just kidding. It can be. No, this is good.
There is some needles and some places that, like the ears, I use the ear a lot. Mm-hmm. The ears could be painful, and the hands and the feet there. But it's like, it just feels like a hair thin needle.
Okay.
They're smaller than when you get drawn, your blood drawn. Okay. So they're super thin, and you might feel a little pinch, but that's it.
And what are some of the benefits of acupuncture for this particular patient population. So we are looking at complex patients that are dealing with a lot of fatigue, a lot of cognitive issues. What are some of the benefits? How does this all work?
Well, in my view, I think that the most important thing that it does is shifts the sympathetic nervous system into the parasympathetic. So those of us who are always in that fight or flight, which I think the majority of people are, even if you're not, I mean, everybody is in that, you're being chased by a lion. So what acupuncture does, it brings you into that parasympathetic state. And that's where the healing happens. Your circulation gets improved, your stress hormones go down. So more blood flow to the area that's being needled. If a patient has pain, those needles are going to signal the brain that something's happening in that area. And these wonderful little chemicals are released into that body part.
It's almost like a micro trauma that the body says it's time to heal. That's very cool. I have not heard it explained like that. That actually is, that's an exciting thought process for me. We talk about a lot of times with individuals that maybe have an autoimmune component, right? And you talked about being chased by a tiger. There's always, with these types of patients, myself included, there's kind of that fear of the flare. Is that part of constant adrenal stress? And can that be helped through acupuncture?
Well, absolutely. I always say stress is the root of everything.
Stress is the root of everything.
Yes. And one thing that, by what I mentioned before with acupuncture, it downregulates the immune system. You want to quiet the immune system.
Okay.
So those patients who have autoimmune disease, it sort of like quiets it down so those flare-ups won't happen.
It was very, very profound for me in getting my autoimmune disorder under control. And I love the way you're explaining it, because I know it happened, but I didn't understand why. The big gap that it shortened for me in care was, it's easy for someone to tell me to kind of quiet my mind or lower my stress level, but I'm a very active person. I'm a hyper person, as you guys all know. It was a passive way to, it's like somebody came in and just tuned in all my thermostats perfectly. I walk out of acupuncture just in a complete Zen state, and that's hard for me. So how does that? Do you see patients once, every other week, twice a week? What's the ideal therapy for these kinds of patients?
The ideal therapy would be more than once a week.
Okay.
Now, unfortunately, it's not covered by a lot of insurances, and not everybody has the ability to pay for acupuncture. Not even, I hardly see, sometimes I do see patients once a week for at least 12 to 16 weeks. It's recommended. But the ideal scenario would be 2, even 3 times a week, at least for 2 or 3 months to get the whole system under control.
And is that to kind of reset the body and then remind it and remind it and remind it?
Yes, you want to keep that.
Yeah. I was
keep that rolling.
I was fortunate to get to be very consistent with twice a week, and it made an impact. And I always sneak to you also when I'm in town. So, okay, you brought up something really important, is that a lot of people don't have access to this integrative approach of medicine. I know that it sets us apart so much. I see our patients benefiting from that. Are there some things that everybody out there can do that is maybe not cost prohibitive? Like, give me 2 or 3 things that we can all do together as a community.
Well, there is acupuncture. There's community acupuncture out there for some people, and some centers provide that. It's in a different setting. A lot of places do like sitting acupuncture. You do in a community setting. They put only like needles in the ear, so it's not as in-depth treatment, but it still works.
What do you think about people that do acupressure at home? Is that effective?
No, that works too.
Okay.
You just have to, more or less, and anybody could look it up. You could look up certain acupuncture points that are very good for the immune system, good for stress. I always recommend massaging your ear. Your ear's amazing.
Ooh, I like that.
Amazing, full of points. You treat the whole body with just treating the ear.
And that stimulus helps to promote healing?
Yes, because the ear is innervated by the vagus nerve, which is the most important nerve to get us to relax.
Is that when we say, I feel stressed, or I feel anxiety, or it's in the pit of my stomach? Is that?
Yeah, exactly.
Yeah. Okay, I'm going to do that. That's fabulous and wonderful. What about techniques for stress reduction that you feel have a direct impact on inflammation or immune system? When you talked about the deep breathing, can you explain that a little bit to us?
Well, breathing exercises are very important. I always recommend, I like Dr. Wales or Dr. Wheels, I can never say that name, but the 4-7-8 method, which is easy to remember.
What is that?
You breathe in for 4 seconds.
Okay.
then you hold it for 7, and you exhale through your mouth for 8.
So do you breathe in through your nose or?
Through your nose.
Okay,
Breathe
in through the nose for
4.
Talk to me through this again. I'm going to do this.
Inhale through your nose through 4
Okay.
to 4. Then hold it for 7.
Okay.
And then exhale through your mouth for 8.
Okay. Okay, that's amazing. How often should we do that?
Every day.
Every day.
Couple times a day.
Couple times a day.
Mm-hmm. Especially whenever you feel stressed.
Okay.
Or you can't get to sleep.
Okay. That's what I was just going to ask you next. I need tips for individuals that are dealing with chronic, complex diagnosis, tips for sleep.
Well, sleep is one of the things that I target.
Yes.
Because I think that sleep is very, very important because it regulates everything. And, I think now with technology could be something against people because people always ask patients, so what do you do before you go to sleep? Oh, I'm on my phone or I'm watching TV.
Yeah.
That's not the best thing to do. You want to get that blue light away from you.
Okay.
You want to minimize, the exposure to electronics and, sleeping in a dark room, cold. There's a lot of things to do. Acupuncture is fascinating for that.
It was a big one for me. Yeah. That's one of the, there's several reasons why I wanted you to come on, but that was one thing that was really re-regulated for me was my sleep patterns with acupuncture. That was pretty profound. So Dr. Junco, a lot of individuals right now, are dealing with kind of the aftermath of the stress, right? We've come through this pandemic situation. But also there's the exposure, the viral exposure and the immune system being active or reactivated. What are some things to watch out for when our bodies are in the recovery process? Are there lifestyle things that we should be really cognizant of as we're healing?
Well, I think nutrition is very, very important.
Thank you. Just kidding.
Nutrition, I know, right? Nutrition, water.
Yeah.
You have to, drink good water quality, because a lot of times, we don't drink good water. Minimizing sugar intake.
And I'm going to just ask you a question about sugar intake. Everybody tells us it's good for us to not do sugar. Can you help me understand what's going on in the body? Like, why should I not do sugar? It's yummy, by the way.
It is. Tell me about it.
But when I'm fighting infection, it's like kind of the first line of defense in a viral perspective. Explain that. What's going on in the body? Why should we not do sugar?
Well, sugar, the bacteria, the viruses, especially the bacteria, they thrive on sugar.
Okay.
So the more sugar we have, the worse the infection's going to take. The longer it's going to take to heal.
It's like putting fertilizer on it.
Right.
Okay.
So you want to minimize your sugar intake. It doesn't mean you can't have sugar, especially like fruits are good, good sugars. A lot of people, drink the Cokes, sodas, just put like 5 tablespoons of sugar in their coffee. Those are things you want to stay away from when you're feeling down. I think limiting sugar, limiting caffeine, limiting alcohol, all those things are important while you're in recovery.
Talk to me a little bit about caffeine. So we've got a body that's under duress or stressed, whether it's something chronic that they're dealing with or acute that they're overcoming. Why would we, I'm a big one, like get caffeine out. It's like, whipping the adrenals or whatever you want to, however I describe it. But why caffeine? Why do we put that out while we're in the healing process?
Well, I just think it has to be in moderation because I myself struggle with that because, I drink 2 cups of coffee a day and that's it.
Okay.
But I think, especially when you're in that healing phase, you want to moderate that because it does activate your stress.
Okay.
It does work on the adrenals. So you want to, try to eliminate that as much as you can. Doesn't mean you can't have it. I just think it should be in moderation. And it also affects your sleep if you drink too much of it or later on during the day. So those are things that you want to take into consideration if you're having trouble sleeping while you're recovering.
I can't tell you how many times people come in and they're not sleeping well, so everything's impacted, right? They're dehydrated, so they're not drinking enough water. They're consuming a lot of sugar to get them through the day, and then they've got a lot of caffeine or coffee through the day, and then they're not sleeping and they don't feel good and they have inflammation. I think sometimes we don't put enough emphasis on those 3 things that you said. If you just assess how you feel in relation to, are you well hydrated? Are you doing too much caffeine, too much stimulus to the body? And are you creating an ecosystem where infectious agents like bacteria, fungal, any of those things can grow? Like, what are you fertilizing here?
Right.
Yeah. What are some of your favorite foods when a person's coming through chronic, complex, or acute illness?
I'm very plant-based oriented.
Okay.
I mean, I do eat meat, not red meat, but I do eat, chicken and fish. But I'm a big advocate for plant-based.
Nice.
I think the more color in your diet when you're healing, the better. Every plate should have color variety. You should have the red, greens, yellow, white, purple. Everything should be in that plate, a rainbow.
I think it's so impressive to me that as we come together and we talk about these complex cases in the clinic, that there is just a consistent theme. Hydration is a consistent theme in our practice. I mean, and you guys have such diverse and legacy education in the immune system and the inflammatory processes and cytokines. We all learned about this the last couple of years. And it still comes back to that. It still comes back to plants, fruits, vegetables, water, having a clean environment.
Right.
Yeah. So we kind of can't out-medicate a bad ecosystem in the patient's body. Yeah. Yeah. For me, that's been so impressive at our institute. So Dr. Junco, I watch, patients come into the clinic and get better and feel better and have access to you. How would someone, I wish when I was in the crisis part of my own health, I wish that I would have had access to you. I didn't know how to ask for that. How would someone out there advocate for themselves or find complementary medicine that is going to be effective? Like ours is the best in the world, right? But how does someone, it is. How does someone out there find their space to get wellness as part of their protocol?
Well, I think they need to be open to receiving holistic alternative medicine.
Okay.
That's the first thing, because when I see patients sometimes, they look at me and they're like, does this really work?
Oh.
And then, they have that doubt. And if you doubt, that's, the brain is such a powerful organ. If you already start doubting from the first time you're there, you have to be open to receiving the healing.
Right.
Whether it's acupuncture, whether it's sound healing, whether it's breath work, whether it's any of the modalities that we do. You have to truly first believe that it's going to help you. And you have to, that's the first key to the process.
I love that you said that, because we're such a science-based research facility, right? So we have studies and trials and provings, and then we see it in our patients. But I didn't even think about the fact that people will walk through the door and have skepticism, right, about the power of this type of medicine. And I do think your belief system, and that's why we want to get this message out here, like we're holding hope out for you.
Right.
We believe you can become well again. And we believe obviously in an integrative approach for medicine. And it's really unique that we're layering that in to immunology, to me, having been out in the wild for so many years. This was really, really unique. When an individual is more receptive, do you think it speeds up their care?
Absolutely. I think that's the first step. And then the other step has to be in the part of the provider.
Right.
Because if the provider, like I always tell my patients, you will get better.
Right.
You are going to get better. Your fatigue is going to improve. You're going to sleep better. And when you put that energy into the treating process, they will get better. And I 100% believe that.
It's a leadership role.
Right.
Right.
So it's a two-way.
Yeah.
It's a two-way relationship between the patient and the provider.
What if someone's out there and they, go talk to their doc and their doc says, I don't believe in acupuncture? Are they in the wrong aspect of care? I'm going to say that because I'm going to say, you're a consumer of medicine, and if they don't share your belief and value system, it's really hard to get well together. How can a person communicate? So I'm going to just say this. I have seen so many times where people say, I don't want to tell my doc that I'm going to see an acupuncturist. Have you ever seen that? Yeah. And I just go, you're supposed to tell them everything, and do you think that's because they'll feel judged? Do you think that's because they don't want to have to validate their complementary care? Or
I just think that unfortunately, and I have a lot of colleagues that I've worked with over the years that they just don't believe it.
Wow.
They're like, there's not enough studies. And there is studies. Not enough that we need to justify it. But they're becoming more and more available.
Right.
But I think that is one of the hurdles, when you have a practitioner who's totally, oh, that's a hoax.
Yeah.
That's.
I think it so blows my mind. I mean, my mom was in the fertility space and they did C-section deliveries with acupuncture as the anesthesia. So it's not like I think it might work. It worked from a pain perspective, from a relief perspective. So Dr. Junco, all of these, our listeners out here really are wanting to get to know a little bit about you. And so can you share some of the lifestyle things that you do that help or are important to you that you hold near and dear to your heart for your own personal wellness?
Well, I'm a big believer in the mind, whole body connection as far as, meditating, praying.
Yes.
Exercising is part of my routine every day, and eating well.
That's wonderful.
I think you have to connect, the mind, the body, and the spiritual all have to be working together in order to achieve wellness.
I love that. Yeah. And that's why you are such a good leader for the patients that need help. You do a great job. I just want to thank you so much for being here. I just am honored to get to be in your presence and work with you and ask you a million questions all the time. And I know it's going to help so many people out there that are really struggling. There's hope for sure. We're here to help for sure.
Yes.
And wouldn't you say we definitely see people turn their health around every day?
Yes, 100%.
Yeah. Thank you for being here. Promise you're going to come back. I want to go deeper into some of these modalities.
Yeah, we will.
All right. Good to see you. And thank you again.
Thank you.